Welcome to the Healing Grove podcast. I'm Dr. Kristen Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hey everyone, welcome back to the Healing Grove podcast. I'm your host, Dr. Kristen Ryman, and I'm here today with Nicole Bell, who is an author, an entrepreneur, and above all, an advocate for people suffering with tick-borne and neurodegenerative diseases. Originally from Boston, Mass, she earned a bachelor's and master's of science in materials science, right, and engineering from MIT, and a master's of science in biomedical engineering from Duke University. So she's no slouch. She's currently the CEO of Galaxy Diagnostics, which is a company well known in the Lyme world for its co-infection and Lyme treatment or testing and standard elevation, and helping people understand that there are other ways to test. We're going to get into some of those differences today. She's going to tell us all about it. And like many who find their way onto this podcast and also into the controversial world that is tick-borne infections, Nicole was thrust into it herself when her husband became debilitated by Lyme disease. She became his caregiver, his medical proxy, and ultimately his widow. Her memoir, What Lurks in the Woods, details this harrowing experience of watching her husband basically succumb to Lyme disease and all of the havoc that it wreaked. And she seeks to help others through this book to navigate similar chronic and debilitating conditions for themselves and loved ones. And over the years, she's added to this advocacy work through her commitment to the Center for Lyme Action, and also as the primary author on the state of Lyme disease research in the United States, which if you haven't read it, I'll put a link to that in the show notes. It's an excellent and 70+ page comprehensive guide to navigating the world of tick-borne illness. So before we do anything else, let me just thank you for that piece of work, because that is a huge gift to any patient or any family member or even any practitioner who's really trying to get their head around this complex and often so debilitating disease. So thank you for that work. So let's just start, Nicole, by you telling us your story.
Yeah, so let's see. I guess starting in the beginning, as you said, I grew up in the Boston area, and I have always gravitated towards math and science. So that was what kind of led me to become an engineer. And I think the other key thing about my career is that I've always been an entrepreneur. So actually, right out of college, my MIT professor started a company and he recruited me to join. And I was, one of the first employees. And I just really fell in love with the small company entrepreneurial aspect. And so pretty much my entire career, I did 2 years in a large company, but I realized that really wasn't the right fit for me. I like being in the midst of everything. I like bringing new technologies to market. And so that's, been where I've focused the majority of my career. And I've done all sorts of different roles in that environment. And then, as you said, I kind of got thrust into tick-borne illness. I don't think, even though I grew up in Massachusetts and my mother would, I remember her, when I went to Martha's Vineyard, she was yelling at me to wear bug spray and stay out of the grass and all sorts of things. But I just never had an awareness of the devastation and how broad it could be until I lived it. And then when I went through that journey with my husband, it kind of became one of those life-altering events where it's like, okay, this is where I can slot in and really make a difference. When you're an entrepreneur and you've worked on other people's companies and you've helped make those a reality, you always have this idea of like, well, what am I going to lean in on? And if I was going to found something or lead something, what would that be in? And, tick-borne illness is that big problem and that I now care about deeply. And so that's kind of where I am.
Yeah, it reminds me of that sort of that ikigai notion of like, what's the Venn diagram overlap of like what the world needs, what you love, what you're really good at, right? And it sounds like you've sort of found your way to that sweet spot despite the hardship of arriving there, right? You know what the passion is.
Yeah, and I think that one of the things that's been the silver lining of our Lyme disease journey is I have gotten involved in advocacy, and I've found all these amazing people who are kind of using their gifts to help make it a different world. I mean, Bonnie Crater at CLA, and and the founders at Galaxy, and a lot of the people that I've met through, I mean, dozens of people that I've met that are really just contributing whatever gifts that they have to really make a different story. And so um it's rewarding to be able to do that. But I think all of us are driven by the fact that we've frankly been through hell and we don't want others to have that same experience. And so talking about the mess, which is why I wrote the book, and being as transparent as I could as of how ugly it can get, from a family's perspective and what it can do to, I mean, we have young children, and just the devastation that it takes on families, as well as, then to my work with CLA, talking about, well, there is a lot of research out there. There is hope and there are options available. And let's figure out how to bring them to market and how to create change so that we can make a different environment. So that's where we are, and we're continuing to push forward.
Looking back over your husband's journey, was it that at the time those resources weren't available or these things were unknown, or was it just a disconnect between what you and your providers had access to?
I think it's all about knowing. I mean, I had worked in the diagnostic industry, and so I don't consider myself an uneducated person. But, also when you go to a doctor, you expect that the answers that you get and the advice that you get are going to be accurate, right? So when we first went to a doctor, my husband, I guess just to back up, I mean, my husband was experiencing all sorts of neurological and, kind of more psychiatric issues. So he was anxious, depressed, he was withdrawn, he was having, bouts of anxiety. As he progressed, he had bouts of rage. And, at first I thought, we had young children. He had stepped back from his career to be Mr. Mom. I thought it was just kind of lifestyle issues. And we went to therapy, but that never seemed to help. And he just was really becoming different in how he viewed the world and how he tackled problems. And I thought we were headed for divorce, frankly, because I was like, well, this is, I tried to push him. I'm like, hey, if retirement isn't working, go back to work, right? Like, we can figure this out. And just nothing was fitting. And then I started realizing that he was also having cognitive issues, and he was a brilliant engineer. He was an electrical engineer, computer scientist, an entrepreneur, and an executive, similar to my background. And he all of a sudden was forgetting the 4-digit code to our house security system. He was forgetting the time to pick up the kids, like very basic things. And that was when I realized something more, pathological was at play, and we decided to go to the doctor. And so to answer your question, we went to the doctor, and one of the first things I had him tested for was Lyme disease, because I did some research and I just started Googling things like brain fog and memory loss, and Lyme popped up. And he was an avid outdoorsman. He loved to mountain bike, to hike, to hunt. He did all of our landscaping. He's been lived all over the country in multiple areas considered endemic, and, many, many tick exposures, right? So it was one of those things that just seemed to fit and make sense. And the first doctor we went to, we had him tested, and he tested negative. And again, there's an expectation of like, okay, we have a test, it says he's negative, so we're barking up the wrong tree. And then they referred us to a neurologist because all of his tests, she did a pretty extensive set of testing, and it was an integrative physician. So it was not just kind of a traditional primary care, but everything came back, quote unquote, normal, right? And they couldn't figure out what was wrong. So she referred him to a neurologist, where he was eventually given a diagnosis of early onset Alzheimer's disease. And that diagnosis made no sense to me. I'm an engineer, right? At the time I was working in robotics, and it's like root cause is how we're built, right? It's like, okay, there's a problem with the robot. What's going on? What's the root cause? Is it a software bug? Is it mechanical? Whatever it is. And I just was frustrated in medicine. My husband's brain was like systematically destroying itself and there were no answers, right? And I was getting chastised by even asking the questions. And it was so difficult and so disheartening. And, we went to 4 different neurologists, and all of them were just basically resigned to tracking his decline because Alzheimer's was the answer. And it's like, that doesn't, I mean, he had no genetic predisposition, no comorbidities. He was declining rapidly, and it never sat well. And
Let me ask, how old was
yeah.
he at that time that he got a diagnosis of early Alzheimer's?
So he was older than I was. So he was 59, 60 years old at the time that we were figuring out that he was sick.
Yeah, so I just want to interject at this point. When I was in medical school, there was no diagnosis of early Alzheimer's. Those words didn't go together. Alzheimer's and dementia, those things came later. And it was in residency just a few years later that people started talking about this. I mean, this is like the early 2000s, right?
Mhm.
So to me, these diseases don't come out of nowhere, right? They always have a root cause. So it sounds like you were, with your engineering brain, kind of already programmed to sort of like look for the root. This doesn't make sense. And what a helpful way to be an advocate, right? To keep pushing. So what happened next?
Well, I mean, frankly, I raged against the machine for a while, but even though my brain is indoctrinated to a root cause approach, I found that traditional medicine really isn't. And it was just, everything was really just more how to treat the symptoms. And that that was difficult. But I wasn't getting anywhere. And so I finally got to the point where I pretty much gave up. And it was actually Russ who said, look, if this is inevitable, then we need to prepare, right? We had young children. They were, at the time, probably about 4 and 8, 4 and 7. And he's like, we've got to figure this out and we've got to prepare. And that was the time when my brother actually reached out to me. And as it turned out, my sister-in-law was having her own health issues, and she had been suffering for years with a slightly different presentation. And she finally figured out, thanks to a astute endocrinologist, that her issues were caused by not only Lyme disease, but by Bartonella and Babesia. And she was starting to kind of go in that realm and figure out how to get treatment and get well. And my brother's a doctor. And so he started researching and understanding these pathogens. And so he was the one that said to me, hey, I think this is what's going on. And we talked about it, and I was like, I know, I had him tested. And then we talked about how bad the tests were and the research he had done. And that was when I kind of re-explored that option, got him retested, and found out that not only did he have Lyme, but he also had Bartonella and Babesia. And that was what kind of started our journey down tick-borne illness, which made complete sense after I started thinking, all of the, for example, Bartonella and the associations with some of the rage and irritability and anger and other things that I was seeing that seemed uncharacteristic for him. You know,
Personality is really.
exactly. And I didn't know. So in terms of your original question, like, was it just not available at the time? I think that some of the things that we could have learned from were available, but you just don't know, right? When you're a caregiver thrust into the middle of it, and I was trying to navigate a full-time job, and I was also trying to navigate, my husband's care, 2 young children, all the things my husband used to do that he was no longer capable of doing, to help out the family. It's overwhelming. It's overwhelming.
Yeah. I mean, if I could ask, what did you lean into in those days to kind of keep your own sanity and strength and resiliency through all that?
I mean, I was so busy. It was really just kind of bouncing from one task to the other. And so the good news is that I've always been a good multitasker, right? I was a student athlete, mom, worker. So I've always really good at kind of balancing multiple things. But I have to say, balancing caregiving with everything else was it almost broke me, because I was trying to just do the things that I was doing, and there was too much. The way that I try and explain it to people, it was like doing 3 full-time jobs, right? Because when you're a caregiver to somebody who's declining so rapidly, like, you have everything that you were doing, right? And then you have all the things that your partner or the person you're caring for was doing that now you have to take on because they can't do them anymore. And then you also have the full-time, you know, role of caregiving and trying to figure out how to navigate the medical landscape and what to do. And so, it's a lot. And so it nearly broke me, at certain points. And I think I eventually smartened up and started looking to things like meditation and exercise and opening up to my friends and getting help. But in the beginning, I was just like, tried to be the Sherpa. You just threw it all in the backpack, and it was not the right choice. It was not the right choice.
Well, I would say that, and I think this is true of people who have Lyme, but also true of their caregivers. Like it really does call on us to start to build up a better foundation for our own well-being, because you
Yeah.
can't do it without that kind
Yep.
of, you can't do it without a team. You can't do it without, people on the team who are, rather than gaslighting you, are helping you and are supporting you and validating you. I mean, there's just so many pieces there. I'm so sorry that this happened. It's a real tragedy, and it's such a sad story. So I'm sorry for your loss.
Oh, well, thank you. I mean, it is, and you would like to think that it's such a tragic story. You would like to think it's unique and that we're an exception. But as I've gone public with our story, and now as I work with patients through the work at Galaxy, I realize that there's so many people that are in a similar situation, and it's hard because it's, you want to do better, you want to have better answers for those patients, but the landscape is still evolving, and it's challenging. It's challenging for people. And so that's why I'm so passionate about advocating and providing resources and better solutions, because it shouldn't be so hard to get the care. The science is there that shows that, this is a real issue.
You're right. It really shouldn't be. And I want to get to what Galaxy does different. But first, I just want to
Mhm.
backtrack, because I know there were some listeners who were going, oh, wait, it didn't show up positive testing the first time they did it. But then the second time, I'm guessing the second time wasn't like the standard two-tiered ELISA and Western blot. And it wasn't like just sending off for titers for Babesia and Bartonella hensley. Like I'm going to go out on a limb and say you did specialty testing. Are you willing to say what you did to get an ultimate diagnosis for him?
Yeah, we did multiple specialty tests. And actually, I think just to kind of confirm, I think he eventually also had visual, like the Bartonella striations that you see on the skin that I had no idea. Even at the time, even after I started becoming educated about Bartonella, I still didn't recognize it until much later. Um, and um, and so yeah, we went and eventually saw a Lyme literate physician and got kind of more comprehensive testing done. But it was and some of the confirmation, like for his Babesia status, so um, he was Babesia antibody based, antibody positive, but I still don't know how much that contributed to his case. And unfortunately, I'm still figuring it out after his death, right? So I donated his brain to science. I now have images of Borrelia in his brain.
Wow.
And the founder of Galaxy, who is actually at the NC State laboratory and one of the innovators in Bartonella and now Babesia, they're doing testing, over there now on his tissues to see what exactly was going on in his neurological tissue. And so we're still uncovering the true answers. And so that's the challenge.
Was he aware at the end
Mhm.
enough to know that a diagnosis had been made and he wasn't early Alzheimer's, and you guys weren't crazy? Like, did he have some of that knowledge?
Yeah, so when we first figured out that it was tick-borne disease, yes, he kind of, and it made sense to him because he never understood the diagnosis of Alzheimer's. I think that's something that never resonated with him either. And tick-borne disease did, because again, he was a hunter, he was in the woods, he had had known tick exposures, and so he was aware, but he did progress rapidly in his dementia. And so at the end, he was not aware of, frankly, anything. It was really just a mere existence. And so, um, we treated for about 18 months, and I think we had lots of ups and downs, but it was so deep rooted in his brain and his, and I think he probably contracted some of these infections years, if not decades before. And because he was healthy, his immune system kept it at bay. But, over time, it really started to lead to his decline. And, um, if we had gotten diagnosed earlier, then maybe the outcome would have been different.
So one of the outcomes has been your work with Galaxy.
Mhm.
and the advocacy stuff you do. Which do you want to talk about next? I think we should talk about testing because I think Galaxy is so unique and not a lot of people. Well, first of all, if you don't go to a Lyme literate practitioner, you're not going to hear about Galaxy probably.
Right.
What are you doing to advocate for that? And also, why is Galaxy so special?
Yeah. So, at the end of Russ's journey, right? I started the advocacy, sharing our story and did work there. But again, I'm an entrepreneur, right? And so it's like, okay, where can I slot in to fix this problem? And I had worked in medical diagnostics before. And so and I was comfortable. I've done medical devices for the second half of my career. I've taken products through the FDA. That seemed like the right place to slot in. And so I started just researching and saying, okay, what specialty labs are out there? What research is out there? And Galaxy stuck out to me for two reasons. One was, of all the labs that were out there and all the technologies that were out there, they had the most peer-reviewed published research, really validating their methodologies and saying, okay, here's the methods that we're using. Here's how we're testing them clinically to show that our tests are clinically meaningful and leading to, uncovering new discoveries within medicine. And just being transparent and peer reviewed and open about what they're doing. And the second reason was that I like the approach, right? So the current standard of care and even some of the other testing and more specialty test methods that are out there are based upon antibody testing. And that's complicated because antibody testing relies upon the host immune response, and we're all different. And a lot of patients, and this has been shown in the research, both in animal models and in humans, that we all respond differently to different stimuli, right? And so some people and some animals have very strong immune responses and peak antibodies. Others don't, and actually will have no immune response. And then also there's people like my husband who, if you're sick for a really long period of time, all your antibody and your immune systems are suppressed. And so there's so many people that get missed with their diagnosis because it's a secondary mechanism. And the analogy I like to give is if you want to figure out if you have COVID or the flu, you don't get an antibody test, right? You get a direct test, you get an antigen test, you get a PCR test. And that just doesn't exist, or it's not mainstream within tick-borne illnesses. And the reason is because these are not rapidly producing, readily available pathogens in kind of traditional samples. They're called stealth pathogens, and they hide in tissues, they replicate slowly. And so if you try and use traditional methods, they're just not going to come up positive because it's not sensitive enough. And so what Galaxy was doing is figuring out how to solve that problem. How do I take a low abundance pathogen and how do I get the right sample where the evidence of the pathogen is going to be present? And then how do I enrich that sample through different means to lower the limits of detection and increase the sensitivity so that I can get an accurate result? And that approach to me was like the holy grail. It's like, we don't want an indirect methodology where, people are on immune suppressants and people are sick and and antibodies take a long time to develop. Even when you're healthy, it can take 4 to 6 weeks. And the time to treat is as soon as you get that infection, because once it disseminates to all your tissues, it's a lot harder to get under control. And so it was the approach that Galaxy took that really enamored me. And so I proactively reached out to the founders and kind of said, okay, hey, what are you doing? And learned more. And once I became convinced that the technology was real, that the company was something that I could help bring to the masses, that's kind of when I got on board and I officially became CEO in June of last year.
Awesome. So what are you doing or what are you planning to bring it to the masses?
Yeah, so we have a lab where we offer testing services directly to physicians. And so that is great. And anybody who wants testing can go to their doctor and they can easily sign up and they can do testing solutions. But, our mission is not to be a specialty lab, right? Our mission is to change the standard of care for vector-borne diseases. And that means getting into the mainstream environment. So we're taking our novel technologies and we are, over the next couple of years, transitioning them to FDA approved kits. So we'll be submitting to the FDA. We'll be partnering with the large clinical labs that are out there. We'll be looking at getting reimbursements. We want to kind of make it the new standard of care, right? And that's kind of where we're headed. So right now we have our lab services and we're trying to expand our reach as much as we can so more patients can get access, but longer term, we want to make sure that everyone has access.
I love it. I love it. And I will say that people who are listening and saying, well, I could just go to my doctor and my doctor will order it. I hope that's true. I hope that's true. A lot of doctors are resistant to ordering things that insurance doesn't pay for or that they didn't learn in medical school. And this is an opportunity for people to educate their doctors and providers.
Yes.
Right. And that's not always easy for someone who's in the midst of their own tick-borne, saga. But that's where a healing team comes in, right?
And for people that reach out, friends and family and other folks, I always just tell people the first thing to do is find a doctor that listens to you, and if you have the ability to go to a functional medicine provider or a Lyme literate physician, because a lot of those places are cash pay operations. And so it's not accessible to everybody. Then that's definitely recommended. But there are a lot of traditional allopathic doctors that are just open-minded. And so try and find somebody that will listen to you and that will work with it. And then there are resources out there. I mean, you mentioned my work with the Center for Lyme Action. I mean, that state of Lyme disease research paper that I wrote in conjunction with a great group of folks advising me is a good resource to give to a doctor. It's a good resource for the patient to read so that they don't feel gaslit by the current environment, because there is solid science that says, hey, there are reasons why these pathogens lead to complex diseases of the heart, the brain, the joints, the skin. I mean, all sorts of solid science, which shows that that's real. But the other thing I encourage people to do is to give it to their providers, right? If they're doubtful of the situation and they don't understand, it's a good way for an open-minded doctor. If it's a closed-minded doctor, you're not going to get that time. But for people that are open-minded, I think there are resources available that can help shed some light on the situation.
Yeah, so well said. There's nothing like an open, humble learner, lifelong learner who's willing to be wrong and not know something.
Yeah.
I'm hopeful that that's more and more baked into medical education. I haven't seen it yet, but I'm hopeful. And I do also think that the more people who are impacted by these diseases and by these complex stealth pathogens, and more and more people are we can talk about that maybe, but I think more and more people are touched by these things, including doctors. I mean, it's why I'm in this field, right? So usually there's a story that someone has who finds their way into this territory.
Yep.
Yeah. So talk to me about the NanoTrap, because I've not actually ever used the NanoTrap and I think I'm heading that way and I want to learn more. Pick your brain a little bit about it.
Yeah. So, again, these pathogens, particularly Borrelia burgdorferi or the pathogens causing Lyme disease, they are stealth pathogens. And so one thing that's important to understand about the Lyme Borrelia is that it doesn't like to be in the blood, right? So this is one of the reasons why antibody, testing can be problematic. It's one of the reasons why we actually have steered away from using either blood or serum as a testing methodology. And these pathogens actually actively evade and suppress the immune system. And there's a lot of research that shows that. It's one of the things I talk about in the state of Lyme disease research is how sneaky these pathogens are, right? Literally manipulating your immune system so that it can persist. And if you think about it from an evolution perspective, right? It's survival, right? The pathogen is just trying to survive. And so ways that it does that are evading and suppressing. And one of the ways that it kind of confuses the immune system is it spits off these surface proteins. And those surface proteins are kind of, secreted into the tissues and bloodstream and so forth And the reason it does that is because if you do have antibodies in your blood, then the antibodies will bind to those free surface proteins as opposed to the pathogen itself. So it's a way of kind of confusing and manipulating the immune system. But what happens, I know it's it's brilliant, really. I mean, if you think about this thing, and it's kind of insidious. But what happens is that these surface proteins actually get filtered through the kidney into the bladder and then secreted in the urine. And so researchers at George Mason University actually figured out that you can use this as a detection methodology, right? So you can take a urine sample, you can capture these surface proteins, concentrate them, and then use it for detection to determine whether or not Borrelia is present. And so their data in acute disease showed, in a series of acute patients, they were able to capture all of there were 20, it's a study they published with 24 patients, 100% of them tested positive with the NanoTrap test, whereas only 50% tested positive with the traditional antibody, based test, the standard of care. And so it's really great for acute Lyme disease, which acute disease is the place where you want to treat, right? Like as soon as you get the pathogen, you want to treat. But it's also been shown to have clinical utility for chronic cases because there, again, especially for somebody that has a known case of Lyme disease, right? And you've been treated and you still feel terrible. And it's like the question is, well, do you still feel terrible because you still have Borrelia, an active infection, which the research shows that actually Borrelia does persist after standard courses of antibiotics. And in fact, research from Dr. Monica Ember's lab shows that no single antibiotic, so the recommended course of deoxycycline, actually does not eradicate the bacteria in animal models. And so, but in some cases, it does kind of clear the infection and help, but other cases it doesn't. And so the question is if you're still feeling sick, are you sick because you still have Borrelia on board? Or are you sick because maybe you have an undiagnosed co-infection, which happens to lots of people? Or are you sick because you have other immune dysregulation that was caused by the pathogen? And so one of the ways our practitioners are using it is to help answer that question, right? Like if you have active shedding of these surface proteins, then that's great evidence that you've got an active case of Borrelia going on, and you might need to consider, continuing to treat. And so it's a great assay for, again, early stage diagnosis, and then even for kind of later stage discernment of whether or not, what's going on. And we've had patients, especially in Pennsylvania, we've had a lot of providers using it up in that area where people are coming into functional medicine practices for other reasons. Like I can't even tell you how many patients we've had that are going into a functional medicine practice because they're having what they consider to be perimenopause. Right. So it's like, okay, I'm tired. I don't feel good. I think I'm in perimenopause. Can you help me, regulate my hormones? And, providers in the area and some of the ones that we work with are cued into tick-borne illness. And so in an astute provider, when doing a medical history, will say, like, for example, in a couple of cases, we've had people that had Lyme disease previously, right? Like in college, right? So it can be a very old case. And so they run the NanoTrap test just to see what's going on. Sure enough, it pops up positive. And then upon treatment, all those symptoms go away. And so, hormonal changes can trigger these pathogens to reemerge. Other infections can trigger these, latent pathogens to reemerge. And so it's just a really useful tool to help figure out what's going on with some of these really complex patients.
Yeah, I mean, it sounds like, and I have a question about negative tests. Do you ever get negative tests in
Yes.
Yeah, so you do. So what is your belief about a negative test? Do you believe that's a true negative, or do you believe that's a person in whom Lyme is really dormant and just not throwing off, still there, still stealth in the tissues, but just not throwing off its surface proteins to create a positive test?
Yeah, I mean, that's the $1 million question, right? Because these pathogens can be so deep rooted in tissues, because they have persister cells which go dormant. I don't necessarily think that you can take a negative and say that means you don't have a single organism of Borrelia in your body, right? I think we've come to realize that our microbiome and our pathobiome is complicated. I think what it is an indication of is that, if you've if you've got a negative, then it's evidence that maybe if you're dealing with active symptoms, that maybe some of the symptoms are caused by something else, or it's, maybe not as active as it might have been at previous stages. And so I think it's difficult to say. We're looking at ways to constantly improve, our detection methodologies and to understand the best ways to get at that question. But and we've got great data in the utility of the assay, but we're continuing to push the envelope on that front.
Yeah. Well, the corollary of that is another question I have, which is how often do you get a positive test in someone who has no symptoms? And not sure why that person's being tested, but maybe you had those controls or you have people who you've looked at.
Yeah, you will get some positives in asymptomatic controls, and it's usually in the single digit percentages. And we're looking as we expand our clinical trials to prepare for FDA. That's one of the things that is important to understand. And I think that there is asymptomatic infection with a lot of these pathogens, right? And so Borrelia, Bartonella, for sure, the same is true in Bartonella. You'll get asymptomatic individuals that will test DNA positive. And I think that that's a key indicator for how these pathogens work. So for example, my husband was asymptomatic and probably infected for a long period of time. And so it's, I like to think of the immune system not as a digital thing, right? It's really more of a tipping point where you can have lots of pathogens on board and maybe your immune system is keeping them at bay and keeping you asymptomatic. But if you reach a tipping point where all of a sudden you transition into illness and pathology, then, that really puts you in a situation where now you are sick and symptomatic. And so understanding what's on board and understanding where you are in your immune system balance is important. And I think we're still collecting that data and figuring out some of the nuances of that.
Yeah. Speaking of tipping points, I wonder if you are noticing more people reaching that tipping point after a COVID infection or a COVID jab, because I'm certainly seeing that in my practice. I'm just wondering what you guys are seeing diagnostically.
Yeah, and I think we hear a lot of our practitioners are basically saying that people seem sicker, right? After kind of some of the COVID environment. We actually have ongoing studies with our research partners at NC State where they're looking at the role of Bartonella in long COVID, right? Because it's like, why are some patients struggling more than others? And I think that the pathobiome that you have on board at the time you get infected is potentially a huge contributor, right? If you've got some latent infections and then all of a sudden you get COVID or you get vaccinated and you stimulate that immune system and you reach a tipping point that tips you into some sort of symptomology or pathology, then, that's going to be, a factor that people need to consider. And so, yeah, we are seeing evidence that, a lot of these things are interrelated.
Yeah. Awesome. Let's switch gears for a second because I want to hear you talk a little bit more about the advocacy work that you're doing, and just let my audience know sort of what resources are there and what's available to them and what can they kind of look forward to in the future, because you're doing so many things.
Yeah. So as I mentioned, I'm a huge fan for the Center for Lyme Action, and we actually just did the fly-in just earlier this week to advocate for more NIH and government spending for research, because a lot of the advancements that I write about in the state of Lyme disease research have been funded by private foundations, right? So government funding, NIH funding for Lyme and tick-borne disease research has been really insufficient. And if you look at other vector-borne diseases, things that are way more rare, like West Nile, malaria, they're much higher on a per patient basis than what you see in Lyme disease, even though that's the fastest vector-borne disease in North America. And so we're continually advocating for change in that area. And one of the things that I like to highlight when we talk to officials and people in the position is that it's actually a really smart investment to invest in this research because, having lived the alternative, right? My husband suffered from dementia, it's like $100,000 a year to put somebody in a resident care facility, right? That's a lot of money. I mean, I personally spent hundreds of thousands of dollars out of pocket between trying to get him treated and then the resulting resident care that he had to go through as he declined in his dementia. It's a huge burden on society. And our healthcare system is filled with chronic illness. You know, over half of our population has some sort of adult population has some sort of chronic disease, and about a third have multiple chronic diseases. And so that is what's crippling our healthcare system. And so if you understand the root causes for a lot of those illnesses and you can fend them off, like if you can take somebody like my husband and give them a timely course of antibiotics, then that whole landscape changes. And so I like to try and advocate for, you know, more research funding, because we're not saying we have all the answers. All we're saying is that this is a viable hypothesis with backed scientific evidence, and it's time to put in more money, because a lot of the things that are going into research for Alzheimer's disease, for example, are still really at the symptom level, right? Like the anti-amyloid beta therapies, there's been, you know, billions that have been invested in that, and they're not effective, right? So let's try a different approach and understand the pathogens that are associated with that. And so I'm super passionate about that. And I've got a good friend of mine and fellow advocate, Nikki Schultek, who is really driving for the role of pathogens in complex chronic illnesses like dementia, and fully support her initiative and what she's doing in that area, because I think it's a critical need. And so, you know, in terms of resources, I think I've already mentioned that paper, which was one of the things I wish I had when I was a caregiver, was the state of Lyme disease research. It was written to be accessible to non-scientific people. There's a lot of figures and explanations, and I think it's something that caregivers, patients, and hopefully providers can use to just get educated. And we've talked about, we did an update on that at iLads for folks that are members of the iLads community at the meeting this year. And we'll probably do the same again at the iLads meeting coming in November in 2025.
Awesome. So, you mentioned funding, you mentioned going in front of our senators this past week, right?
Yep.
And I'd love to talk a little bit about that, because I think people in the Lyme community often are looking for ways to get involved and aren't always clear about how can I be of service in this way. So maybe we can touch on what the role of just normal human beings in America might be in future fly-ins. But I also wonder if we can talk about politics, because the first 100 days of this administration have been a lot. And one of the things that's gone down recently is cutting of some funding for research. How do you think that's going to impact? Like, what are your concerns, or you know, what are your reasons for hope around what's happening?
Yeah, I mean, it's hard to say how things are going to shake out. I think even though it's a super tumultuous time and there's a lot of, you know, frankly, chaos going on in various areas, I do think for the Lyme and tick-borne disease community, there's hope, because again, I think that the overall mission is to reduce spend. And this is a great way, you know, research in this space and understanding and really trying to accurately detect and diagnose infections early will have a fantastic ROI for our healthcare system. And I know RFK is a polarizing personality, but he understands the complexities of Lyme disease, and he is, you know, a fan of functional medicine and some of the methodologies. And so I really try and stay out of the politics of it and really stick to the science. And I'm really hopeful because the science is strong. And if you can prove the science and if you can make the case, it may take a little bit of while to get it through, but I do think that we have a great case for why it makes sense to invest into these conditions, because it's linked to so many complex chronic disease states. I mean, one of the things I haven't talked about is mental health, right? There is so much evidence mounting that in both Lyme disease and Bartonella, the linkage of those pathogens to depression, suicide, schizophrenia, psychosis. I mean, there's more and more evidence mounting from some of our research partners and other folks that shows this is a real thing. And I lived it, frankly, with my husband. I mean, my husband was hallucinating. He was this extremely rational, you know, logical engineer. And then all of a sudden with his illness, he thought people were one of the reasons the book is called What Lurks in the Woods is not only because of ticks, but also because in my husband's hallucinations, he thought there were people living in my woods trying to kill us. He would regularly say there were people out there with machine guns, snipers. One day, when he was particularly stressed out in a hurricane, he told me that there was somebody swinging from the trees on a vine with a machine gun, like things that are just nonsensical. And I wouldn't believe that somebody like him could say something like that until I lived it. And I watched him, in complete, it was so real to him. It was as real as, a tangible item for one of us to him. And so seeing that firsthand really made me realize that, we're really, biochemistry matters, right? Like we're a ball of cytokines and signaling molecules. And when that goes haywire with a pathogen, then the you and the person that you think that can be completely fundamentally altered. And we have multiple case studies that we've seen with kids. Like one of the stories we talk about was a case study that was done with our research partners at NC State. Was a young boy who presented with psychosis, and his parents spent over $400,000 on psychiatric care. And eventually an astute provider realized that he had the striations associated with Bartonella. They referred him to Dr. Schwartz at NC State. He got tested. He had multiple strains of Bartonella. He got treated with the appropriate antibiotics, and all of his symptoms went away. He went back to high school. He graduated valedictorian of his class. He went on to college. And it's like, how many of these cases are out there? How many people can get their lives back with the appropriate treatment and with getting the test that they need at the right time? And so I feel like I'm rambling now, but I'm very passionate about, really understanding. And I think that the ROI is going to be there, that this will be good for the tick-borne disease community.
Yeah. Yeah. I mean, I feel that so deeply. And I have seen people recover in such a way that you're like, yeah, this is the person who was underneath that mind that was poisoned by an infection or poisoned by a toxin or poisoned by mold. Like I always encourage people to keep looking, because if it's not normal, if it's not what you would expect of a child this age or a person this age, like just keep looking.
Yeah.
Just because you haven't found it yet doesn't mean there isn't actually something there stealing this person's mind, as Daniel Amen would say.
Yeah.
He would say mental illness is a physical disease that steals your mind.
Yeah. I mean, in another example, I don't know if you're familiar with Colonel Nicole Malachowski. She was the first female Thunderbird pilot. She was she worked at the White House under both the Bush and Obama administration. I mean, she was literally a combat veteran, that fighter pilot. And she essentially, at her time here in North Carolina at Fort Bragg, and then eventually up in the Northeast in Rhode Island, multiple tick exposures, and basically got her career stolen, right? And she was sick in a wheelchair, but she describes her experience with Bartonella. And, she says she had auditory hallucinations. I mean, this is a combat veteran. And she described it as, she was so paranoid, she would kind of sit in her room looking out the window because she thought people were after her, and she was hearing these voices. And as soon as she started, treatment with either rifampin or rifabutin, I can't remember which one she was on, almost immediately all the symptoms went away, and she hasn't had them since. And so, again, it really can hijack who you are and change the fundamental way you think. And I think more people need to fully understand that.
Yeah. I mean, if you take away one thing from this conversation, I hope you take away that a diagnosis of mental illness is never just the label and the description. There's always something underneath. It's just a matter of finding it and looking for it in the right ways.
Yeah.
So before we wrap up, tell us about how the fly-in went and tell us about
Yeah.
how we can get involved in the future if people want to be a part of that.
Yeah, so the fly-in is a fantastic, thing that happens annually in February. It's for the Center for Lyme Action Coordinated. This is my third year contributing, and I'm happy to say that each year it gets more and more organized. And this was our largest group of advocates ever, and so that's fantastic. And I think the great news is that you don't have to have any experience or training to attend. You can go and they'll do all the training. They have their storytelling workshops so that you contribute, or you can just contribute and be a silent supporter, right? And there's ways that you can get involved. It's a relatively light lift, and it's a good way to talk to your senators and Congress people and say, how important this issue is, and to tell them the stories so that they understand the gravity and the importance of these issues, because it's not just a Northeast or a Midwest issue, it's everywhere, right? And tick-borne disease is not just Lyme disease, it's, all of these emerging pathogens with Bartonella, Babesia, alpha-gal, Ehrlichia, there's so anaplasma, there's so many. And each of them are kind of endemic in different areas. And so raising that awareness and talking to congressional staffers and is just how change happens. And so I think the fly-in this year was fantastic. Megan Bradshaw, who is now with the Center for Lyme Action full-time, is a phenomenal individual, and she did a great job organizing this year. And I think, this year's activities are kind of wrapping up, although there's still some ongoing work filling out appropriations forms and other types of things to facilitate. But I would encourage people every year when they put out the call for advocates to get involved, and contribute in some way, even if it's just being there and showing your support and, really letting people know that this is something that's impacting their constituents.
Awesome. Well, I'll full disclosure, I learned about it just this year and I signed up, and then I went and marked the wrong dates on my calendar for when
Oh,
to
no.
well, I actually got my little scarf. So they send you a scarf.
Yes, I have it's somewhere in my, I have one, I have two. I declined one this year. I have one in my office and one at home.
This is my scarf for next year, and this is my online in the world commitment to actually being organized enough to join next year. I will say I did get to go to some of the prep meetings. And
Yep.
so I tell you, I can totally vouch for the organization and the hand holding that is provided. So if
Yeah.
you're a person who's never imagined themselves going in front of on a virtual fly-in where you're like talking to your senator and their staffers, like me, because I've never done that either. This is my invitation to you guys to join me next year, because I think it's a really important and powerfully impactful activity and way to advocate.
Yeah. I mean, like I said, I'm not a political person. I usually kind I try and stay out of the fray, but this is something that's near and dear to my heart, and it's a great way to contribute.
Yeah. Awesome. Is there anything else that we haven't talked about yet that you'd like to share with this audience of wellness seekers, possibly people with diagnosed or undiagnosed Lyme, people with mystery illnesses who are still seeking for ideas to help themselves?
Yeah. I mean, I think that a couple things I would share is I know how hard it is, and I know how much you're probably questioning yourself as part of the journey. Because I know I did. I mean, I was trying to do research and get educated, and you hear so many different things and you feel so confused. And so I think, one of the things people get intimidated by is, I'm not an expert. I'm not a scientist. I'm not a doctor and so forth. But, you know, I like to tell people you're an expert in you, right? Like, something's wrong, and don't ever forget or doubt that, because if you know something's wrong, there's a reason why. And a lot of these diagnoses that people get are really just fancy names for symptoms. I mean, even Alzheimer's disease, they don't know the root cause. It's a fancy name for symptoms and for molecular pathways that we don't fully understand. And so I just encourage people to keep digging. I also encourage people to consider, especially if you're high risk, to consider vector-borne pathogens as a route. And I think people think about ticks, and it's like, well, there's a few things. One, I've never been bit by a tick, and I would say that's potentially true. A lot of times ticks are really small. You might not see one. But the other thing I like to get people to understand is it's not just ticks, right? Like Bartonella has so many vectors, right? Spiders, fleas, lice infestations, cats have 6 orders of magnitude more Bartonella in their blood than humans do. And so if you've ever had a flea infestation, or a cat has licked an open wound, or you've got, a cat scratch, like those are things. I can't tell you how many cases I've heard of the onset of really severe symptoms from Bartonella after somebody adopted a cat. That story of the 14-year-old boy with sudden onset psychosis, that was coincident with an adoption of a cat. And I don't mean to be an alarmist. I just want people to be aware that it's not just a tick bite, right? I mean, we've spider bites and all sorts of other things that we have documented evidence, with Bartonella. And then I think there's so many other pathogens that I just want people to open their minds and think, hey, this is something that I should consider. And the testing matters, right? Like I'm working and I'd like to have our testing and our capability in the hands of the LabCorps and the Quests of the world, but the tests that they offer now are not sufficient. And there's better options available. Obviously, I believe firmly in Galaxy's approach. Those are things that people should understand and get access to if they need those answers and want to understand if it's impacting their case.
Well said. Well, thank you so much for everything that you do. And above all, for this time today, being willing to share some of your experience and your story and some of these wonderful tools that you get to share.
Yeah, thank you for having me and for all the advocacy work that you do to kind of share and give an outlet and voice to people that are going through this, tumultuous situations, because it really can be quite difficult.
Yeah. I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.